So we're getting ready to work on the foot massage routine. You want to have your person set up with appropriate support underneath the ankles, underneath the sheet. You'll have a sheet covering the person so that you can maintain coverage over their legs because they're wearing shorts. And you'll have a support underneath their head area, a little bit bigger than their head to move in the direction of their chest, and just high enough elevation so that they can have comfort as they perhaps put their head to one side. After talking with your receiver and seeing if there's any issues that they may have with their feet, remember what contraindications you've learned, and then begin. With your warmed up oil or cream, effleurage the foot so that you're covering the whole foot with cream. Then place your fingers on the top of the foot, your thumbs on the ball of the foot, and begin to give circular friction to the ball of the foot. So you're leaning in with your body weight so that you can give a firm pressure. Then you'll move on to the next step, and that's using your whole thumbs, so it's a broader surface all the way up the bottom of the foot, all the way up the sole of the foot. Slide down and begin again, using your whole thumb. Sliding down and beginning again, leaning forward. Then we're going to move a little bit deeper by taking the hand that's on the outside of the foot to support around the ankle, and yet you're leaning into the pillow support underneath the ankle. So I'm not lifting up the ankle, but I'm just supporting around. And my tool of choice is the fist. You'll be leaning forward and deciding on what type of work you're going to use with the fist. Perhaps you're sliding all the way up. Perhaps you're using scoops. Really able to work more deeply. Always moving forward. And then on the heel as well. From there we slide into working alongside the Achilles tendon. So I'm pulling back down towards the heel and squeezing on each side of the Achilles tendon and leaning forward. Moving forward and leaning back. Squeezing on each side of the Achilles tendon. Forward and back. And now I'm going to lift the foot up. Simply lift the leg upwards and move yourself to the side so that your face is facing the outer ankle of your receiver. Take your hand that is closest to their head and give support either underneath the ankle or above the ankle, and use your other hand to hold the foot and press it upward. You're having an opposing force. Provide a lot of security around the ankle, letting your receiver know that you are supporting the leg. They don't have to worry about the leg dropping as you're pushing the upper foot towards the ceiling. You're pressing with this hand. Then allow for an opposite pressure by using your hand or part of your forearm as well to lean downwards. Decide if you want to move towards your knees so that you can use leverage of your torso weight to lean down, providing more support and weight for this calf lengthening. Move back to your position. Create support around the foot and support around below the ankle or above the ankle, and begin to create a small rotation of the ankle, and then begin to create a motion that moves towards the greatest range of motion that your receiver has for their ankle. Move in the opposite direction. If your receiver is resisting this movement or assisting with this movement, you can just ask your receiver just to let go and allow yourself to give this motion so they can be totally passive during it. We finish up by going back to your original position so that you can be facing your toes, and we create a movement that shakes the whole calf region, provides a movement for the foot, the upper foot, and a loosening by taking your hand below your fingers, gluing them to just below the toes on each side, pressing there, moving one hand up and one hand down. So you're rolling the foot. You can begin slowly and then move more quickly, and you can notice the shaking of the calf muscle. If you're sliding too much, take the sheet or an extra towel that you have and give that pressure on each side and begin to create that shaking motion of the leg and the rolling of the foot. After you complete that, bring the leg back down to the support. Finish off with a final goodbye, effleurage, using both hands, saying goodbye to the foot and beginning to work on the leg. I would suggest at this time that you take the sheet and tuck it around shorts, so you're draping around the shorts, and then on the inside you can tuck this top sheet underneath the leg. Back in your position by the foot, you can be kneeling if it's comfortable for you. You might be even sitting on a pillow yourself to provide support. Take the warmed cream or oil in your hands, slide forward just as far as is a comfortable reach for yourself, effleuraging the leg, spreading the lubricant, and then you begin with the first step, taking your palm, using the broad surface of the palm, leaning forward, draining the leg upwards. We're going towards the heart. Allow yourself to lean forward. You could be in a kneeling position or in a position where you can use some of your torso weight to add to this pressure. After doing that for perhaps 10 times, then give the pressure to your thumb and your fingers on each hand. So your receiver will feel a more specific pressure along the inside and the outside of the leg, and be aware that your receiver will experience that very differently, as the inside might want a lighter pressure than the outside. But check in with your receiver. The next time that you come down to the ankle, take both of your thumbs together beside each other, lean in right on top of the Achilles tendon, and begin to slide upwards, maybe an inch or two, and then take one thumb out to the side, the next other thumb out to the side, slide in the center as though you were separating muscles of the calf to one side and then the other side. So one at a time, sliding up further, making sure that you are giving pressure in the center of the calf before you strum the connective tissue out to the side. So one side, then the other, and then move all the way up to just below the back of the knee. Take your hands to the side and slide lightly down and begin again. Leaning in, strumming out to the side. One, and then the other. And remember, one of our contraindications is varicose veins. We want to not give any pressure if you see varicose veins on the leg. And this second is any bruising. We're going to avoid that area. Okay. Maybe you would do this 3 or 4 times. And then the last time you'd move your body so that you are now perpendicular to the lower leg, and we're going to knead here, so you can decide how you can sit comfortably. I'm sort of side sitting. Squeeze and lift, squeeze and lift, using your whole hand, using your whole hand. So we've been working the tissue of the lower back leg. We've been moving that tissue in a lot of different ways with our 4 different strokes for the lower leg. So then our next area of work is the back of the knee. Again, I will shift my weight. So I'm going to side sit on the leg that is closest to my receiver's body, placing my fingers on the side of the knee on each side, using my thumbs to give a pressure that is neither too deep nor too light. We don't want to tickle the person's back of knee. Using a broad stroke of our whole thumb, not just the pads of the thumb, but the whole thumb. And we are facing in the direction of our receiver's head so that we can move easily into the next step, as we see that working on the back of the thigh is what we're doing. So I'm getting a little bit more oil, sliding upwards, Giving a firm, solid pressure with my effleurage, and then moving straight into using my fist. One fist following the other, bringing that fist down before that other fist leaves. And then moving slightly laterally, bringing pressure there too. Going as far as my fists can go. So hopefully you've rolled up the shorts as far as they can go. Wrap that sheet around to provide a boundary. And working on these hamstrings, leaning forward, using your body weight so you can give a solid pressure in this area. This is our main stroke for this area, so you could do this for maybe 20 strokes. Okay. And next we're going to move to the hip. Place your hand that is closest to their head. Use the center of the palm and place it on the sacrum. So the center of your palm is on the sacrum. It is passive but not moving. And you take your fist and you just give a little nurturing push. We're working on the muscles of the whole buttock region. But more important, we're creating a rocking motion for the entire body. We're rolling the body to help induce relaxation of the whole hip area, whole pelvic region, just relaxing this area. Think of it as just relaxing further by rocking the person into a deeper relaxation, and at the same time you're giving compression to the larger muscles of the buttock region. So I'm moving my fist around. That's our first step. Our second step is to reach down with the hand closest to the foot and bring it upwards. When that happens, I take my hand from the sacrum and I just lift up just slightly and dangle the foot. So I'm creating more rocking, but it's in a slightly different direction. Lifting up so I can be on my knees, elevate. I'm resting for a moment and then doing this again. And you might find that the leg is too heavy for you, and this may not be the step that's appropriate for your size. You could also have the leg supported and just begin to roll the leg from side to side. You're still getting some gentle joint movement for the entire leg, and that can be also relaxing. I'm not lifting the leg, I'm just rolling it on my hand. Okay, so you can choose either of those movements. From there, I take my hand at the ankle area. I move back to my original position, and I can use my fist or my forearm, whichever feels best. Just be careful if you're using your forearm to not lean into the elbow area. When you're on the floor, it may be easier to use your fist. Working on the table, it might be easier to use your forearm. And begin to create a movement, a small movement, circular movement moving the leg, supporting firmly around the ankle. You want to feel the movement of the tissue underneath your fist, and I'm moving in the other direction. Feel free to increase the size of this movement if that's available to your receiver. Begin to, again, keep the support around the ankle so that they feel secure enough to not have to hold their leg up. Move in both directions. Feel that movement under your fist. If you need to adjust where you have your fist, do that. And then the last time that you come near the support, just rest the leg. And here we move into our very last step, and this is tapotment. So tapotment is also called percussion, and we are giving kind of swift movements with our hands. We can use the sides of our hands, or loose fists, or even a form of pummeling, but you're still wanting to keep your wrists loose. You work all the way down the leg. You can go back and forth, spend a lot of time in the buttock area, and then the thigh. You just want to avoid the back of the knee. Remember, we don't want to feel bone when we use tapotment at all. So for instance, perhaps I'm going to start like this. Loose wrists, I could move down the leg, I could come back. Maybe I choose to use loose fists. I could move back again. And then I can choose to give a final effleurage for the entire leg. I should either be sitting near the foot or lower on the foot. Final effleurage for the leg. Wrap the leg, keep it warm, and then saying goodbye for the last time over the sheet. And that's your foot, back of leg, and hip routine for one leg. Keep your hand on that one foot as you then move to the next foot to begin.